Okay. Well, you guys see the screen here. BrainWorks. Here's the rundown of our usual rules of the calls. Please prepare to be on time early when the meeting begins. We stay on topic with conversations. We're honest and respectful to each other. But the things we don't discuss is politics, religion, or sex. Patience, one person speaks at a time. We're here to assist one another without judgment, to be supportive of one another. This is a relaxing, comfortable, and honest place. We are not therapists, although the calls have been therapeutic for each other. Face-to-face, one-on-one communication on Zoom, obviously, over here. Calls are recorded for protection of members. As a business, recordings are not shared without consent from everyone on the calls. Please be consistent. We're here to help each other, and others look forward to keeping in touch. That's what I was saying before, is like the groups of us that are on the calls on a regular basis, we all build very valuable friendships with one another. Oh, look, see, somebody just joined in and their timing was perfect because I just said that. Please be on time.
Of course.
Okay, I'll just admit for her to join in. Oh, I know Denise. Maybe we'll have people on tonight. It's hit or miss. Everybody's got schedules and stuff, so when they could make meetings and when they can't, that's why we do them at 2 different times. Plus the other thing, like Lisa and you, Louis, time zones, because we talk to people. Our calls at night or in the Philippines and Australia, we have members, and it's Friday morning for them, so they make the calls on our Friday on our 8 p.m. call or our night calls here. I'm waiting. I'm waiting for Denise to get audio.
So I just figured out on my phone, Louis, I don't know if this works for you, but if you just swipe your thumb over, it'll take you to the screen that's got everybody on video.
Yeah, I got it figured out now.
Okay, good. Good.
Yeah, we're all good. It took me a while, but I got it. But thank you.
Calls before, because I remember talking to you about you reminded us you were on the call last week, wasn't it?
I think 2 weeks ago.
2 weeks ago, yeah, because I remember, because you remind me of an old friend of ours.
Yeah, that's what you were saying.
Yeah. See, your memory is pretty good too. Denise,
yeah, it's a slurred speech.
Yeah.
That's okay.
Sounds clear to me.
Yep, I can hear you. I can hear you loud and clear.
The good thing is I'm not satisfied, and I tell people don't settle. Oh, everybody's got room to improve. Everyone.
Oh yeah. I mean, you should have heard me 7 years ago. Whoa.
Yes.
Now it's like really good compared to that, but it's still bad for where I was. Oh man, it's a night today.
As talkative as I am, when I came out of the coma, I had to go for speech therapy too. So I totally get it. That's why I never judge anybody. And like I was saying earlier, everything is respecting each other's pros and cons.
Yes. So. I'm sorry to interrupt. I'm late in the group. My first time in the group. I would like to introduce. I'm listed as Denise, but I like to be called Dee, if possible.
What, Dee?
Hi, everyone. I've had 3 concussions and one was comatose as well. So I understand. Go ahead with the conversation.
Where's your video? I want to see your face.
Can you see my face?
No.
Profile.
Really?
No, her profile picture is her face. Yes.
Yeah.
You only see my
face.
You don't see my live picture?
No.
No,
Yeah.
just your
Let me
still
let me
shot.
let me work on that. Hold
Yeah,
on a
you-
second. I mean, not that it matters to me. I'm very, I'm a science geek. I really don't look like one, but I really am. I am just as, I always say, I'm just as ordinary as you are. Or I'm just, actually, I help the homeless a lot. So I always say, I'm just as ugly as you are. Because they always look at me like, what are you doing here? You know, but anyway,
I'm a bit of a,
I'm gonna work on the picture.
okay, I'm a bit of that medical geek too. Like we all have that same quality.
Oh, I got it. I got it. I got it. I'm also was in management,
Oh,
so
there
I
she
just have to
is.
I just have to figure it out.
Welcome. Now
Thank
it's
you.
official.
Now,
All right, I'm
you see my
continue
Christmas tree? Go ahead. Talk. Yeah.
because we have a number of things
Go
I
ahead.
wanted to go, and then we could
Yes,
chit
sir.
chat. And it's
Go
okay.
right
Oh,
ahead.
don't call
Cheers.
Look, oh yeah, that we were just joking around about our coffees. Yes, liquid motivation, I call it.
I have English tea. Go right ahead.
Oh, I love that too. I'm with Tina.
Tetley.
So,
ahead.
okay, we were going over support calls, participation agreement. This is just part of the introduction we do on the calls.
Okay.
Uh,
I'll be quiet. Sorry.
okay.
I'm excited.
I'm early when meetings begin. Please stay on topic with the conversation. We're honest and respectful to one another. We don't discuss politics, religion, or sex.
That's great.
We're patient. One person speaks at a time. We're here to assist without judgment. We should be supportive of one another. This is a comfortable and honest place. We're not therapists, although the calls have been therapeutic for one another. That's people think that I'm a therapist a lot, but Julie, a number of us have said to us over and over again that they enjoy joining these calls because it's very therapeutic for them because it's a place to vent, to talk, and meet other people who understand, and that's the rarity. We're face-to-face communication with Zoom, obviously. Calls are recorded for the protection of members as a business. The recordings are not shared publicly without consent from everybody that's on the calls. That's something we'll go over later. You know, if everything's cool, then we ask for permission. And then some people say, no, I'd rather not. Sometimes they say, sure, let's go ahead, because we try to share them because this is educational for people to know who we are and what we're all about. Please be consistent. The more often we get together, the better. And we build valuable friendships and relationships with one another by being on the calls together. We're a close-knit family. We're here to help each other. Others look forward to keeping in touch. If there's an issue, I'm hearing it. So somebody might want to turn the volume down on your speakers so it doesn't echo. We're here as a support group for survivors, families, friends, and public education about neurological impairments and brain injury. You do not need to be a survivor to be on our calls. Anyone associated with neurological issues is more than welcome to be on our calls. Our goals is to assist one another with our knowledge and experience to help one another. Our calendar to see times, topics, and phone numbers to call into are on ASBISG.org. Zoom meetings will start at 12 p.m. Eastern Time and 8 p.m. Eastern Time each Thursday in the US. That comes 5 p.m. in Europe and 10 a.m. on Fridays in the Philippines and Australia, where we have members there as well.
Wow.
Important aspects of our calls is a positive, relaxed, and respectful atmosphere for each other. Next slide. The timeline that we have, this is what we do every week when we're having the calls on both times, is an introduction, which is now. Say hello to introduce ourselves, which we have. Discussion of the topic that we have, like today, it's about anger after brain injury. And then after we go over the presentation and, we discuss things and things like that, we try to keep time open for a conclusion to openly chat, and we could talk just about anything. And
Fabulous.
sometimes when I do, like when we record the calls, like right now, everything's very cool. I could shorten it. So whatever we talk about at the end of this, I have to mute. All right. We often have to mute because of the background noise on everybody's screen. So I just had to mute. Dee, I see you apologizing, but she's muted. Okay. So anyway, like I was saying, in the conclusion, we don't have to share that part. So if we want to have an open chat about anything, I could edit that if I share it. So what we discuss at the ending, it doesn't have to be public. All right. We did this. It says, let's go around the room and briefly introduce ourselves, our names, where we live, and what brings us here. And the host will go over the list of participants. We've done that already, which is cool. It's important for everyone to introduce themselves so others are comfortable knowing who each other are opening up to. Okay. And here's the topic we're talking about. I can't hear you, Dee. There's a lot of talking.
Okay, I'm sorry. Go right ahead. I'm just new. I'm a newie,
I know.
newbie. Go
We
ahead, sir.
get a little excited and nervous as they're like, uh-oh, All right. So, anger after a brain injury. This is part of the research that I've done. And of course, some of it's from experience as well. And I wrote this through like doing this for so many years together. Dee doesn't know, I was explaining, we've been doing this every week for 17 years and doing them on online format.
Yeah.
Between Skype and now we're using Zoom. The past 5 years we've been doing Zoom because of the ability that we have to do presentations like this and things like that. Anger after brain injury. Anger and irritability are important and persistent clinical problems following traumatic brain injury. This is a topic that was brought up to me that was important because it's a real common issue with both caregivers and survivors after brain injury. Often include medications, behavioral modifications, psychotherapies, but some are impractical and some have been proven efficacy with this population. We suggest one-on-one treatments, group therapy, anger self-management training, which is ASMT. That's the medical term, designed specifically for people with TBIs who have cognitive impairments. There is a need for personal readjustment and education, which is created for both participants and the significant others. The primary outcome is change in self-reported anger on validated measures of self-assessment. Somebody had asked me about this just yesterday and the day before that. What can I do? I have these problems with anger management. And I said, it's got to start with you because you're the only person that could really start with bettering your life. It's got to come from your actions, your self-control and self-discipline. The primary outcome is the change of self-reported anger on validated measurements by self-assessment. Secondary outcomes include participant anger by a significant other, emotional distress in domains other than anger, irritability, behavioral functioning, and the quality of life. What that means in itself is the environment that you're in. And sometimes the problem isn't just your own anger, but the people that are around you that assist with negativity that's going to have an impact on you as well. So all those things have to be addressed in order to for a better, like I said, quality of life. Uh-oh, I can't see the screen here. Bear with me 1 second. Uh-oh, wait a second. What type of screen I have going on here? As many as 1/3 of survivors of TBI experience symptoms ranging from irritability to aggressive outbursts that are identified as new or worse since the injury. Unlike other emotional states that may exacerbate by TBI, such as depression, anger may not remit spontaneously, and problematic irritability has been linked to unfair social outcomes such as family problems, social isolation, and loss of employment. Thus, it is important to develop and evaluate the efficacy of treatments for post-traumatic anger and irritability. Psychoeducational methods based on cognitive behavioral therapy, CBT, to teach new skills, and they're effective for anger management in the general population, but often require a level of abstraction, which means thinking about thinking, like the way you're thinking, like it's analyzing yourself, a self-assessment that is often difficult for patients with TBI. Cognitive behavioral therapy, or CBT, focuses on interconnections of thoughts, emotions, and behaviors. This is part I was talking about, self-discipline and self-education, because you got to learn about the new you. CBT, that cognitive behavioral therapy, is effective but takes time to master. So be patient with yourself. CBT strategies include things like questioning fearful thoughts, slowly trying out new or different activities, and using your senses to ground yourself to the present. CBT is a form of talk therapy where you interact, but isn't about dredging up your past. Instead, it focuses on the present and teaches you to recognize how you respond to stressors in your life and how you might change your responses in order to ease your distress. Everything that we do on these calls for all these years that we've been doing them is about positivity and moving forward in the right direction to better your lives. Oh, okay, there we go. Now here's one that's a common trait, and I've been victim of it myself and had to learn a lot of self-control, is impulse control, reactions. Temper outbursts after TBI are likely caused by several factors, including the injury of the parts of the brain that controls emotional expression. Absolutely. There's all different areas of the brain that everybody talks about, the frontal lobes, because it's the common trait, but there's different triggers that cause those impulsivities to happen, and the outbursts and reactions. Frustration and dissatisfaction with changes in life brought on by the injuries, such as loss of one's job and independence, feeling isolated, depressed, or misunderstood.
All the above.
All survivors know these traits because it happens to all of us.
Oh yeah. When I was younger, real young, my grandmother always used to say, "Oh, she's in the mood again." When I was, I must have been 7.
Mm-hmm.
She would say, "Oh, she's in the mood again." They'd make light of it, but you know, she must have done something or smothering me.
Susan had her TBI.
Oh, yeah.
When 3 years old, she was a little less than 3 years old. She got hit by
I was 3 years old as well when I first had it was my first injury right here on my front. Where my stitches, I had a violent upbringing in my home.
Me too. I understand that one. But and they didn't years ago. They didn't even have a diagnosis for TBIs. It was just, oh, you hit your head, done. You know.
Exactly. We were like cement blocks, actually, children growing up in this sort of environment without actually, as you were reading this, I'm applauding you. If only there were other educational counselors, perhaps even doctors, shall I say doctors, anyone perhaps to even identify these traits and characteristics that we had to identify with to just help us go through this, having instead to go through these terrible, lessons to have to deal with it independently sometimes. I know I did myself.
Absolutely.
But I'm strong for it.
That's one of the things, like I've been doing medical work for 30 years. We were talking about that before. And there's things that medical books don't teach, and that's experience.
Exactly.
And
Oh boy, that's a lot.
Touches base on what you were just saying, Dee.
Yeah, on a lot of things. Yeah.
Most doctors in med school, they don't teach them about TBIs.
They don't teach them a lot of, well, it's not a natural thing. I actually not only had to go through the mental with the injury of my head, but I have so many bodily injuries that, well, many do, of course, not a big deal, but they gave me so many opiates at one point. Actually, it was over 200 daily for over, I think, 15 years. Finally, my intestines collapsed.
Yeah.
So I had to deal with that independently, of course. And there was so many instances where I came close to dying. It was just, I'm grateful to be alive every day. I'm so grateful for every day I wake up.
How often do we hear that with us in the brain injury community? We're grateful every day you're taking a breath as you're alive, and rejoice. Absolutely. Amen. That's great. Yep. Well, we were talking about outsiders' perspectives, and here it's funny because that's exactly what we're going to go over in this next slide. Is family members of individuals with TBI often describe the injured person as having a short fuse, flying off the handle easily. Studies show that up to 71% of people with TBI are frequently irritable. The injured person may yell, use bad language, throw objects, slam fists into things, slam doors, or threaten or hurt family members to others. That's a generalization. That's not everybody, because.
Well, that sounds familiar.
Yeah, that's
familiar. A little bit, just a little.
Yeah, some of us are verbal. Like I don't, and some of it, see, like you were just saying, some of it is psychological because we don't put up with any crap anymore. We stand our ground and we stand up for ourselves, and especially when it comes to misjudgments and labeling. So that's why.
Trying to figure it out.
Right. Well, trying to figure it out, but also dealing with like we were saying before, the environment around us. Some people don't understand.
Judgment. Yeah.
They don't understand.
Terrible.
Here we are. It feels like we're the black sheep and we're defending ourselves because nobody else.
Yes. Yeah, well, yes. I just want to interject real quick. Like, it made me tearfully to join this group. I lost both of my daughters and my grandson recently as adults, and I have changed. They just could not. They would not. And I'm different now. They just see a monster still. It's very sad. And yet, and I'm hearing you tell me this educational stuff, and if only they would know this, you know, because this is actually the first time I've ever went to any type of group. This is the first time in my whole life. I've always been, you know, you need mental help. You know, you have no problems. Go away. You know, this is the first time in my whole 57 years of life.
Well,
So
this is why
that was too much FYI.
no. It hits home for me because I've gone through the same thing with my children as well.
Yep.
It's preconceived notions and the struggles that we have with people not being informed and not being educated about what comes along with brain injuries. This isn't me making it up, and it's a hidden disability, and we're not faking it.
That's right.
I fall right in the category. I have ataxia, and like 99% of the world has never heard of that word.
Mm-hmm.
It's an invisible disability. The best way I can explain it, you have a night of drinking, you wake up in the morning, you're in that drunken hangover haze, there's ataxia. You bang into the walls, your speech is slurred. The morning after your night out, there's ataxia. But it's visible and nobody knows or understands. Who knows what the word is?
Yes.
On my website, I put definitions of what things are, and that's one of the pages is on ataxia and aphasia. I missed before type of thing coming up with the right things to say and the wording and things like that. It's all very, very common, and that's why I did it, so people can understand and learn.
Yeah,
Are.
they need to.
And those of us like survivors, we can go here. You want to know about what I'm going through or my injuries? Look, and that's what my website is based on: being able to share information, educate the people that are around us about it. Because the hardest trouble that we have as survivors is getting other people around us to understand.
Amen.
Amen.
Well, let me go back about this short fuse things, about what causes the problems that creates this irritability. Temporary outbursts after a TBI are likely caused by several factors, including injury to the parts of the brain that control emotional expression. That's what I was saying before about frontal lobe issues.
Yes.
And dissatisfaction with the changes in life brought on by the injury, such as loss of one's jobs and independence, feeling isolated, depressed, and misunderstood. All of us know that one. Different, that's why we stick together. Difficulty concentrating, remembering, expressing oneself, and following conversations, all of which lead to frustration. Cognitive, what's the word I'm looking? See, there we go. The cognitive mental wear, which makes us tired easily, is the wear makes us very, very tired. And pain management. Again,
yes, pain management. Good point.
People talk about like what they visibly can see and what they can't see, but they don't understand that what you're going through also comes with pain, and nobody can see pain. They can only hear about it. Outsiders don't understand that one.
Yeah, get it all the time. They can't see it. I always get it all the time. They always think I'm a superwoman, and by the appearance they see, and you know, it's you know, this is the first time I actually have people that I can actually, you know, let my hair down, even though it is down already. But you know what I mean. It's quite unusual. I feel kind of unusual. I do feel unusual. That is obviously not the word I'm looking for. It's caught me off guard. So there you go.
I know
right
what
ahead.
you mean.
Yes, it's exciting in a way.
Good.
So, thank you. I appreciate all of you.
Thank you. I was telling Lisa before, D, is there's some issues that we have individually. I mean, we help each other as a group, but if there's things that you need to talk to one-on-one, you can contact me.
Sure.
And we do one-on-one counseling services as well as these group meetings every week. But this is obviously, we're family. We are an adopted family. We understand each other, and that's why you're getting choked up, because you're like, wow, I found people that understand, and that's why we do what we do. It
Well,
brings
I have no family.
well, you do now.
Right on.
Accept it. It is what it is.
Welcome.
Wow. Thank you.
You're welcome. What can be done about temper problems? Reducing stress and decreasing irritating situations can remove some of the triggers for temper outbursts and irritability. You walk away from a situation and contact one of us, and we help each other through it. That's another one. People with brain injuries can learn some basic anger management skills, such as self-calming strategies, relaxation, and better communication methods. A psychologist or other mental health professional familiar with TBI can help, and that's what we are. Certain medications can be prescribed to help control of temper outbursts. I'm not a big fan of pharmaceuticals. Some people.
Neither am I.
Sometimes as a Band-Aid it helps, but you're still not
Yeah.
addressing. So sometimes it helps. I'm an advocate for medical marijuana now, because it's legal.
Amen.
And that's a nice relaxation technique. And I also, but outside of that, is also meditation, talking to one another, a phone call away, that kind of thing is huge.
I've been alone all my life, so this is just, Laree Bell, the person that introduced me to this group, she is actually the only close person I have in this whole world. Craziness. But anyway, I know her from when I was 13. We went through hell and back as kids in the street, of course. But go ahead, sir. I'm sorry, I don't even know your name. I missed that part.
Oh, Michael Idell.
Michael Idell. Okay, I apologize. Thank you for the interruption. Continue. Thank you.
I'm gonna put in the chat here the website address and my phone.
Fabulous.
And all right, there we go. My name, my phone number, and the website.
Great.
Write that down if you'd like.
I see it. Thank y'all.
Family members can help by changing the way they react to temper outbursts. And this is really what I'd like to see, is more family members to be involved on these calls so they can get a little more education, like we were just talking about. They need to understand that being irritable and getting angry easily is due to the brain injury. Try not to take it personally. Try not to argue with the injured person during the outburst. Instead, let them cool down for a few minutes, think things out, and then you can communicate. Communication is the key. That's the biggest trouble that we have on almost all of our conference calls that we have with the specific topics, like with the one we had last week, was about communication. Do not try to calm the person down by giving in to his or her demands. Set some rules for communication. Let the injured person know that it's not acceptable to yell at, threaten, or hurt others. Refuse to talk to the injured person when he or she is yelling or throwing a temper tantrum. Let them chill out. And that's with any situation. Let them chill out and let them set the pace of when things could be discussed. After the outburst is over, talk about what might have led to the outburst. Mutual respect for one another. That's establishment right there. Encourage the injured person to discuss the problem in a calm way. Suggest other outlets, leaving the room and taking a walk, after letting others know when he or she will return when the person feels anger coming on. I've been accused of walking away from a situation, and it's called that I'm bailing out and I'm not manning up and blah, blah, blah. That is such an immature adolescent way of
Yes.
addressing any situation, because immediately that puts the person on the defensive because you're trying to insult them to feel better about yourself. Walking away is a proper
Exactly.
creating a situation so it doesn't escalate. You let things calm down and then you could talk about things rationally.
Right.
Yep.
I used to, when someone got me mad, I just walked out for a while.
Mhm.
My used to say, "Oh, you going no place again?" I said, "Yeah."
Yep. Here we go. I
And
miss
I learned to control it. I mean, I always somehow I always put myself, after I got angry, of course, I always put myself in the other person's shoes. I turn the tables. I call it turning the tables.
You know, it's funny. What's funny about that is this label that's about the brain injury survivor, but there's people without brain injuries that never had a brain injury. Have an issue with calming down, finding a right time and place, and management of their own control that creates a problem. And that is a big issue that needs to be addressed.
Now we're talking about society.
It's that, yeah. The people that are quote unquote normal or think they are. That's an arrogant.
Oh, we're talking about the wild, wild west of America now.
Yeah.
And a lot of people have brain injuries that don't even know it.
Mm-hmm.
True.
Exactly. Oh yeah. And that's becoming a little more relevant lately because actually concussions are becoming more aware. Like people are becoming more aware of the repercussions that come along with concussions and things like that. Or like we were talking about last,
Ignored.
the hidden,
They're ignored.
yeah. The I
Sorry
talked
to interrupt you.
with shaken baby syndrome.
Yeah.
People think that because, oh, you didn't hit your head and you didn't fracture your skull, that you didn't have a brain injury. But it happens internally. And you can't see that kind of stuff. There was a lady that was on a call last week that had a car accident, and because she didn't fracture her skull, there was no bleeding, that, oh, she was faking her injury and this isn't real. And another aspect that is easily overlooked is PTSD.
Yeah.
Because post-traumatic stress due to any kind of life-changing event is going to have an emotional impact on your coping and what you're going to put up with and what you're not. Which brings us to this slide here. Is how we help each other.
A familiar one, I see.
Yeah, what makes us more successful in helping each other. And remember that too. It says, remember that not all help comes from professionals. And we had talked about that before. You may benefit from a brain injury support group. Some are specialized in people with TBIs, and others are family members, and others are open to everyone affected by brain injury. Again, communication, an open-minded establishment where you could speak freely to one another to enlighten each other to what we're going through. Peer mentoring, like us, we're all survivors, in which a person that has coped for a long time gives support and suggestions to someone who is struggling with the similar problems. And we've all touched base on that here. And simply like we were talking about, even outside of these calls, talk to a friend, a family member, or a member of a clergy, church, religious aspect, or someone else who's a good listener is always beneficial. Bottling things up inside ourselves is like, what's the phrase I use? You can only pour so much into a cup before it overflows. And when you pour things up, it's going to overflow. You need somebody that's going to listen. Sometimes it's not even for the other person to say anything, just to know that there's somebody that can understand and listen is a good thing.
Yeah.
My cat is really good. My cat does really good at that.
I have a retired, well, some of you guys know, I have a retired police dog, who's
Oh,
14.
fabulous.
Yeah, she's 14 years old and she has bad hips. She can't even move around, but she's my therapy. You know, 'cause
Oh, definitely.
they don't say nothing. They're non-judgmental. All they want is love, and that's
Yes.
all we need. I'm a little hippie in that aspect. It's just
Me too.
that kind of stuff.
My cat's name is Dog.
That's great. Oh, I love it.
And she comes to realize she acts like a dog as well. When I leave, she has anxiety. She goes around to me. She acts like a dog, really bad. It's so funny.
That's so funny. Yeah, this one sits at the side of the bed. When I leave, she lays in front of the door. I leave her outside because she can be unattended, but I leave her outside on a leash. Oh, my phone's going crazy.
Now it's your turn.
My turn. But when I drive up and she sees me, not anybody else, I have 11 tenants that live in this house. And she doesn't bark at anybody, but as soon as she sees my car or my motorcycle, she starts freaking out. Yeah, because it's me.
Papa. Yep. Love is love.
Yeah, yeah.
Mhm.
So
Yep.
the people, we're on the call, and there's a lot of us that are on these calls on a regular basis, and we get to know one another well. So this is the conclusion part. Are there any celebrations you'd like to bring up over the past week since you've been on the calls? Now there's me, Susan, and Julie that are on.